Then you track master pass paper 3. One unit of a diabetic mother following a difficult labor through water delivery or sound shows right-sided complex source equivalent mass in the region of adrenal, which is diagnosed non-traumatic adrenal hemorrhage because caused by neonatal stress. 2. What identifying would suggest diagnosis of pheochromocytoma rather than adrenal adenoma. Explanation of greater than 30 HU because pheochromocytoma has less fat than adenoma, so it is greater than 30 HU explanation. 3. What adrenal finding would suggest diagnosis of myelolipoma rather than adrenal adenoma, parent of large amount of mature fat. 4. Mass on the right side adrenal. What feature would favor right side lesion being instead adrenal adenoma? Intake effect on cumulative MI. 5. CT shows adrenal mass. Which adrenal finding would suggest diagnosis of adrenal adenoma rather than adrenal metastasis? A rate of 26 HU on delayed and 13 minutes after contrast injection. Number 26 means adrenal adenoma. A rate of 26 on delayed images 15 minutes after contrast injection. 6. Diagnosis of pheochromocytoma. Which of the following tests would be dangerous due to risk of precipitating life-threatening hypertension? He is not on alpha or beta blocking drug. Diagnosed CT code biopsy. We do not do biopsy in pheochromocytoma. 7. Adrenal metastasis. In which part of the adrenal do these characteristics occur? In corticomedullary junction. 8. CT shows incidental adrenal lesion. This is cystic in appearance and measured 4 cm. The wall is thin at 2 mm and the contents are homogeneous with armed water retention. No enhancement following the temperature of internal contrast, which are diagnosed lymphangioma. Remember this water retention and then so there's a cystic, so water retention is seen lymphangioma. 9. Palpable blush lump on mammography. Speculate the rare soft density shown on both MRO and CC views with associated pleomorphic microquantification. Corneal biopsy shows the malignant lesion. What histological type most likely? Invasive ductal carcinoma. Most common cancer of breast is invasive ductal carcinoma. 10. 54-year-old patient, woman, postmenopause. Mammograph screen shows well-defined 10 mm mass in the left upper outer quadrant. Near fetal would raise likelihood of this malignancy. Non-mammogram 3 years previously. Because after mammogram, neither cyst nor papilloma grow. So non-mammogram 3 years previously will support that this is malignancy. 11. Mass in the left axilla. Which of the following findings are strongly suggestive of malignancy? Speculated lesion with the plateau in the post-initial phase on from T1 weighted images. Where speculated lesion is malignancy. 12. MRI follow-up. Which of the following represents optimal timing with MRI scan? 6 months after open biopsy, 7 to 20 days after menses, and 6 months after open biopsy. Optimal time with the MRI scan follow-up is 6 months after open biopsy, MRI we do. 7 to 20 days after menses, and 6 months after open biopsy. 313. Diagnosis of papilloma. What is the most common site of breast masses? Upper outer quadrant. 14. Woman undergoes lumpectomy. MRI 10 days later shows an ill-defined distorted mass of low signal tension on both T1 and T2 images with peripheral ring of high signal on T1 and low signal on T2. Moderate diffuse reactive enhancement shown in the lesion with continuous post-initial increase in the enhancement. No central uptake in lesion, which I can explain for the spreading. Post-surgical hematoma. When there's no central uptake within the lesion. And then this is MRI shows T1, T2, peripheral ring of high signal on T1 and low signal on T2. This peripheral ring high on T1 shows hemorrhage, blood content. And then moderate diffuse reactive enhancement shown in the lesion. The continuous post-initial increase in enhancement, so this is post-surgical hematoma. 15. Breastfeeding prenatal right breast, temperature of 38 degrees Celsius. Which of the following breast describes the expected MRI findings? High signal on T2, T1 and T2 weighted images with average peripheral enhancement without central uptake on contrast and T1 weighted images. In mastitis, there is no central uptake on contrast. Remember this word, without central uptake on contrast. High on T1, T2, and without central uptake on contrast and T1. 16. What is the approximate cancer detection rate of the enhanced breast screening program? 6 per 1,000 women screened. 17. History of cervical breast fullness, tenderness, and pain, and enlarged nodal pattern seen on mammography. Ductal pattern seen on the ultrasound with duct ectasia, cyst, and ill-defined lesion. Which of the following statements relating to this study is most accurate? Self-scan may be present. The cervical breast fullness, and then nodal pattern and mammography. This is duct ectasia and cyst independent. So sclerosing adenitis and calcification may be present. Sclerosing adenosis, I think. 18. Area of fat necrosis is spread. What is the risk of malignant transformer in the area? 0% is not premalignant. 19. Intermittent mass which is paired with discharge from nipple. Nipple discharge is produced on comparison of specific trigger point in the earlier region. Mammography shows subanerular amorphous code calcification. Ultrasound is hypochoric mass identified with an exterior diarrhea drug. Amino drawn down with signal earlier paragraph 21. What are diagnosed central sorority papilloma. When the mass which appears with discharge from nipple is most likely papilloma and produced on comparison of specific trigger points of papilloma. 20. 11-year-old girl who has not started menstruating or sound through MRI pelvic mass is hypochoric with low level intravenous within it most likely diagnosed hematocolpus with no menses and then pelvic mass. 21. 16-year-old weak gestation, the corrected alpha protein level nowhere to be raised, will probably cause for this neural tube defect. 22. What adrenaline finding would suggest a diagnosis of endometriosis rather than MRI cyst, multiple further lesions in the pelvis. 23. What adrenaline finding would suggest a diagnosis of endometrial polyp rather than primary carcinoma of endometrium, pressure which led within a stockman colored Doppler blood. 24. Sample shows elevated level of estrogen, pelvic ultrasound and multilocal cystic adrenal mass measuring 30 cm with thick fibrous separation but no intracystic papillary interaction, which is diagnosed as adult granulosa tumor. Elevated level of estrogen seen granulosa tumor. What identifying would suggest a diagnosis of prolapse subnuchal fibroids rather than cervical carcinoma. Hyperintensity on T2 weighted images because fibroids consist of fibers, so less fat, so lower on T2. 26. The placenta is completely covering the internal organ, the most likely diagnosis, central placenta previa. 29. What is the most typical signal characteristic on MRI of a subserosal fibroid? Low signal on T2 weighted images. Subserosal fibroid shows low signal on T2. 28. Family history of Beckman-Wiedemann or horizontal polyadenoma is associated with the most likely diagnosis. Beckman-Wiedemann syndrome associated with Wilmsure. 29. Pregnant women has raised alpha-fetoprotein level or ultrasound shows an flat inwardly curved contour of both frontal lobes and a positive curve of the cerebellum, most likely diagnosed spinal macula. Cerebellum curve is called banana and frontal lobe scallops is called lemon sign. 30. Palpebral mass behind the labia minora. MRI shows small mass which is of high homogeneous signal on T2 weighted images, most likely diagnosed Bartholin gland cyst. 21. What identifying was suggested diagnosis of malignant melanoma rather than carcinoma. High signal on T1 weighted images. 32. A female patient has been referred to the gynecology with pelvic pain and the gynecology team is concerned about salpingitis. What finding would be most suggestive of tuberculosis rather than another cause? Bilateral disease. 33. Fever and increased left side chronic pain over a period of 3 days. Ultrasound shows thickening and enlargement of the damage and testes on the left. The left test is hyperechoric compared to the right. Radiographic imaging shows marked increased perfusion through primary cord vessels with COVID-19 increased activity immediately and centered in the left hemisphere on static images. The most accurate in this condition. Case with testicles infarct in approximately 3% of cases. Epidermitis shows testes infarcted due to oxygen compression, and this is a sign of symptom of epidermitis. Thickening of the enlargement of epidermis and testes. Left test is hypochoric compared to the right, and then right imaging with marked increased perfusion through primary cord vessels. So the epidermitis may lead to testicular infarction in approximately 3% of cases. 34. South African male with painless hematuria cystoscopy shows an enlarged area of abnormal appearing mucosa on the posterior bladder wall. He has signs of portal hypertension. He is described to control hematomas in the past. Most likely diagnosed squamous cell carcinoma of the bladder. All these signs and symptoms show squamous cell carcinoma of the bladder. Schistosomiasis of squamous cell carcinoma. 35. Posterior urethral valve when is usually diagnosed first year of life. Using persistent painful erection, what is the appropriate management? Cavernosal aspiration or irrigation. 37. A 50-year-old man presented with difficulty by passing urine, retrograde urethrogram to urethral stricture was most likely cause. Dignity to prove is gonococcal infection. There is no pain, eye pain or irritation, so sexual due to previous gonococcal infection. 38. Painful scrotum. Ultrasound testing is difficult because of tenderness and achogenic thyroids. In the posterior also note skin capitis, most likely diagnosed pulmonary gangrene. 39. Ultrasound shows an anechoic region on the right side here with posterior causing enhancement, most appropriate management, routine neurological referral. 40. Ultrasound right side simple hydrocephalus. Right testis appears abdominal bright. What technical criteria of ultrasonography appearance for this? Found for this appearance, time gain compensation. 41. What sequence would be best for detection of extension of tumor to the bladder wall? T1 weighted images. T1 for anatomy, T2 for pathology. So extension of T1 to balance water is T1. For T what period would be more in keeping with BPH? Central enlargement with calcium and mixed equidensity. Central in BPH there is central enlargement. In carcinoma there is peripheral enlargement. 43. Woman with a renal transplant, cystoscopic yellowish plague-like area was found and biopsy most likely diagnosed malicoblastia. Therefore, varicocele is considering embolization. What should be discussed during the process of operating consent? No symptom improvement in approximately 10% of cases in varicocele treatment. 45. 19-week pregnant. Ultrasound maternal shows left side had an approach. That's next investigation. T2 where static fluid MR urography. In pregnancy, we do static MRI. T2 static MRI in pregnancy. 46. Acute uncomplicated ascending bacterial paranephritis. What appearance is likely to be seen on CT? Alternating branch of hypo and hypertending of the renal parenchyma seen in ascending bacterial paranephritis. For example, what initial finding would suggest diagnosis of VHL syndrome in this patient? A single central nervous system hemangioblastoma seen in wheelchair. 48. Followed after receiving a renal transplant, they are noted to have dilated collective system and rising creatinine most likely causes ureteric ischemia. Renal transplant, then there is dilated collective system and rising creatinine most likely causes ureteric ischemia. For CT shows the heterogeneity inhaling soft urgency mass arising from the perirenal space, displaying the kidney and containing internal program calcification, amount of low intensity mass on T1 where images internal areas of high signal to not represent hemorrhage, T2 where images show very high signal with a ball of fluid appearance, of an intermixed low and intermediate signal, high T2, low T1 where lesions within the vertebral body also seen, present most likely diagnosis, malignant fibrous histiocytoma. Ball of fluid appearance seen in malignant fibrous histiocytoma. Ball of fluid appearance, malignant fibrous histiocytoma.